June 21 is the cut-off date for when Safer Care Victoria will accept submissions from chiropractors and from patients and members of the public. If you haven't already done so, please log on and make your submission. You can go to the Chiropractic Association website.
It was just over a year ago that the COAG Health Council put out its communique announcing the establishment of the Safer Care Victoria review. Can you walk us through our journey of advocating for members since that time?
So when Safer Care Victoria first initiated their program, we had to hit the ground running and hit it really fast. So the great thing firstly was to get Matthew Fisher on the panel of Safer Care Victoria, so we were able to facilitate that and ensure that the right sort of information got onto that panel. Secondly was about engaging the membership so that we had our ACA champions getting involved and going and knocking on the doors of their local members of parliament.
The process of gathering information, looking what was the research, looking at how this was going to be played out, became an important part in guiding our activities. And this is where the advocacy came to the fore. So contacts were made with all state, territory and Commonwealth health ministers and their either heads of staff or chief advisors, people like that, so we could engage in a conversation. And with that, it's important of what you take forward. It's not a matter of going forward and saying, we've got a problem. It's got to say, how do we participate and ensure that the full story is being heard.
Well, last year was certainly a challenging time as the profession faced the Safer Care Victoria review. Can you walk us through your experiences of the public consultation that happened as part of that review?
Yes, when the ACA gave us the green light to ask our patients to support us, because let's face it, apart from the ACA, our patients are our biggest supporters, and that's what saved us in the past with Royal Commissions and everything else. We went to our patients once again and asked them to fill out the survey for the Safer Care Victoria situation, and they did so in droves. And I think that's borne out by the results.
Well, the proof was in the pudding. The message really did get out there to chiros, and the message did get out to chiropractic patients. I had a number of patients that responded, and we were able to generate, it seemed from the statistics that I was hearing, a really high number of connections from not only chiropractors, perhaps more importantly the families.
So I found this a really exciting time for our practice and for the practitioners that worked here. It was an opportunity to really pump up the excitement even to a new level about chiropractic care and encourage families to make a submission. We were really proactive. We made sure that every single family knew about it and they had multiple touch points so they could easily click on the link and do their submission.
Many of my patients were very, very quick to put in their own personal submissions. So I thought the association made that well known, and patients felt very pleased that their concerns were taken seriously and they had an avenue in which to say things.
There was an invitation perhaps that was helpful, which was to connect with local politicians, and I thought that was quite helpful. It was an easy thing to step into for a busy practitioner who's fielding calls from lots of different people about what's going on in the paediatric field. It was a very easy thing to kind of take action on and get the job done.
Switching gears, how has the ACA advocated for the chiropractic profession during the COVID-19 pandemic?
We were buoyed by our relationship with the Allied Health Professions Australia in that we had direct contact with the Health Minister, direct contact with the Chief Medical Officer, and we were able to get the right information to them and receive the right information that we could then distill down to the members. This was a really important relationship for the ACA so that we were in a position where we could hold the hand of the membership through this whole COVID-19 pandemic.
Due to COVID-19, many organisations like the ACA had to pivot their activities in response. We were set to launch our Consider a Chiro campaign, our 3 to 5 year public engagement campaign, So instead we decided to focus our attention on a new working from home campaign in response to the large number of Australians who suddenly found themselves working from home. The campaign was quite successful in both the public space and also with our members. But I'd love to hear from you guys on how the campaign was with your patient base and what you saw of the media uptake.
So with the working from home campaign, that was useful in that what we were able to do was then just bring that information through to our practice members. And we had a lot of discussions in my office about what's actually appropriate. People were starting to develop some symptomatology from not only the inappropriate workstations that they were using, but also what happens with lack of connection. And so the ACA's initiative was useful with that, so we could actually, again, just bring that information across.
I used the working from home campaign. I send out regular emails to all my patients, and I was able to compile like a really great email, including the link to the video, all the information that you guys sent out in that kit, and I sent that out to my whole patient base. I got really great feedback back from that because a lot of my patients were working from home, and they felt that it was a really nice way to touch base with them when a lot of them sort of felt like they were being a bit isolated. It was funny because it wasn't intended to sort of get people to book in, but it really did. Sending out that email where I was giving them good advice, so many people then thought, oh gosh, yes, I must book in for an appointment. So it really bumped up my bookings as well, which was a side effect, but was great. It was really good, it was really simple, and it was just the way it was put together, very simple tips, but things that people felt like they could use. And yeah, it was a really good campaign actually. I enjoyed it, and so did my patients.